Good evening, respected organizers, co-organizers, seniors, and dear participants. I am Dr. Vibha Yadav, Associate Professor, Department of Veterinary Microbiology, College of Veterinary Science and Animal Husbandry, Acharya Narendra University of Agriculture and Technology, Kumargan, Ayodhya. Here to deliver my lecture on topic extended spectrum beta-lactamase genes threat to public health. Let's begin this session. First, as we all know that era of antimicrobial chemotherapy begins in 1928 with Fleming's discovery of penicillin. That antibiotic penicillin, earlier known as magic bullet, that would end infectious disease. Antibiotics are important medicine that is used for treating bacterial infection in both human and animals. But unfortunately, many of bacteria becoming resistant to these existing antibiotics. Now, the over and indiscriminate use of these antimicrobials result in antimicrobial resistance. Then, what is antimicrobial resistance? As per World Health Organization, antimicrobial resistance is defined as resistance of the organism to an antimicrobial agent to which it was originally sensitive. And nowadays, antimicrobial resistance is the point of discussion, both in human as well as animals. And it is one of the major obstacles that is faced by clinicians, researchers, pharmaceuticals, and it is one of the serious public health threat of 21st century. The spectrum antibiotic resistant microbe worldwide concern due to public health persistence of post-antibiotic era. Some microorganisms develop multiple drug resistance, that is called superbugs. That means they develop resistance at least one antibiotics of 3 different classes. Nowadays, it is one of the serious concern that is development of emergence of superbugs. This slide depicts the current scenario of antimicrobial resistance. This picture, this slide depicts the statistical and current scenario of antimicrobial resistance across the world. Here we see that near about 40,000 patients die due to in USA due to infection of antibiotic resistance Clostridium difficile. Likewise, 2,300 patients die per year as a result of antibiotic resistance in USA. Same here, 25,000 patients die each year in Europe due to this antibiotic resistance. And it is estimated that about 2 million infections per year, 2 million infections occurs per year in USA due to this antimicrobial resistance. And about 1,100 estimated that occur in USA due to methicillin resistant Staphylococcus aureus. And it is also reported that about 480,000 people infected with TB, drug resistant bacteria in 2013 globally. And it is also reported that child die every 9 minutes with due to this antibiotic resistance bacteria. So nowadays, antimicrobial resistance is a serious concern across the world, and it attracted the attention of larger scientific community across the antimicrobial resistance. What are major causes of antimicrobial resistance? There are so many causes that is related to antimicrobial resistance, like inappropriate doses and duration. Inappropriate use of antibiotics are major cause of antimicrobial resistance. Frequent and overuse of antibiotic also one of cause of antimicrobial resistance. And unregulated antibiotic access. Unregulated antibiotic access is also one of the cause that is development of antimicrobial resistance, and lack of proper diagnostic testing. Broad spectrum use of antibiotics, poor hygienic condition, zoonotic transmission, and chronic infection. These are major factors that is responsible for causing the antimicrobial resistance. Then common resistance pathogen in animals. There are so many resistance pathogen in animals that is responsible for causing the major problem: ESBL producing Escherichia coli, methicillin resistance, Staphylococcus aureus, multiple drug resistance, Salmonella species, and Venco-resistant enterococci. Then what is the beta-lactamase antibiotics? Beta-lactamase antibiotics is a group of antibiotics that contain beta-lactam ring in their structure, like penicillin, cephalosporin, cefamycin, and monobactam. These are group of beta-lactam group of antibiotics. All beta-lactam group of antibiotics have a beta-lactam ring in their molecular structure, a special structure that is called beta-lactam ring. How this beta-lactam antibiotic acts? So beta-lactam antibiotic mainly disrupt the bacterial cell wall synthesis by linking covalently to the enzyme, that is transpeptidase enzyme, or we can say penicillin binding protein, that is located in the cell wall and play major role making the peptide bond between the D-alanine and D-alanine. And D-alanine is the major substrate for this transpeptidase enzyme. That's why they play this transpeptide enzyme play important role in the formation of bacterial cell wall. And these beta-lactam antibiotics, they bind, they have active site that is bind to the this active site of this transpeptidase are penicillin binding proteins. That's why they become unable to make proper synthesis of cell wall due to breakage of cell wall. There is a breakage in the synthesis of cell wall, that the bacteria become die. So in this way, these beta-lactam antibiotics acts. Then what is the major cause of beta-lactam resistance? There are so many causes, but three are major causes. That is mutation in the gene encoding the penicillin binding protein. Due to mutation, the characters of this penicillin binding protein are carboxypeptidase enzyme nature changer, and also change in the cell wall permeability, that is called active influx pressure. And one of the major cause to develop resistance against these antibiotics due to release of beta-lactamase. Beta-lactamase is an enzyme that play important role in destruction of penicillin binding protein. And this extended spectrum beta-lactamase is a enzyme that is produced by some bacteria that destruct the beta-lactam and activity of beta-lactam antibiotics. They are unable to produce their effect. And this mainly occurred due to continuous mutation of these genes that converted into the extended spectrum beta-lactamase. These extended spectrum beta-lactamase genes are encoded either chromosomally or on plasmid. That means there is genes situated both on chromosome as well as plasmids. And plasmids are extra chromosomal genetic material that is not very crucial for the survival of bacteria. So they are, by the plasmid, they are horizontally transmitted from one animal to another animal or animal to human beings. So these beta-lactamase belong to two groups. As per Ambler, they belong to class A group, and as per Bush and Geography, they belong to group 2B. The first beta-lactamase are identified in 1914 before penicillins became clinically used and was termed by penicillin. Term ESBL was coined by Philippons in Then there are different beta-lactamase genes. As per Bradford, there is TAM gene, SHV gene, and CTMX gene. But CTMX gene is globally dominant extended spectrum beta-lactamase gene that is responsible for developing resistance against these antibiotics. And these extended spectrum beta-lactamase genes reported in livestock and other livestock that is mainly responsible for causing the colibacillosis, mastitis, and urinary tract infections. Hospital-acquired infections are also ICU's intensive care unit infections. They are zoonotic in nature. And these ESBL gene linked to spread between human, animal, and environment because they are zoonotic in nature. And some of the extended spectrum genes are hospital-acquired nosocomial infection that are transmitted from the human to animal. Then mode of action of beta-lactamase. How beta-lactamase enzyme acts. The main characteristic of beta-lactamase enzyme, they causes the hydrolysis of cyclic amide, amidine and other carbon nitrogen bond that is present in the beta-lactam ring of beta-lactam antibiotics. As earlier I have shown that the beta-lactam antibiotic contain a beta-lactam ring that is made up 3 carbon and 1 nitrogen bonds. These enzyme acts on these carbon nitrogen bond and they cause their destruction. So in picture we see that these are penicillin binding. There is penicillin binding protein that is called cross peptide transpeptidase or penicillin binding protein. They play important role in the synthesis of cell wall of bacteria. And these enzymes, that is extended spectrum beta lactamase enzyme, they are released and they bind to peptide beta lactam ring of beta lactam antibiotics, and they cause the hydrolysis of amide or amine, that is bond between the carbon and nitrogen disrupt. That's why due to beta lactam ring hydrolysis, they are not able to bind the active site of transpeptidase or penicillin binding proteins. So these enzymes are able to synthesize the cell wall. So that's this antibiotic failed to destroy the bacterial. In this way, these beta-lactam antibiotics acts. That means mainly they bind, they cause the hydrolysis of carbon-nitrogen bond that is present in the beta-lactam ring of this antibiotic. That's why they are unable to bind the penicillin binding protein or transpeptidase. Due to unbinding, they are able to synthesize the cell wall of bacteria, and they ultimately the bacteria are able to survive and cause the destruction. What is the genetic basis of these genes? So basically, extended spectrum beta lactamase genes are encoded by BLA genes such as BLA-TAM, BLA-SHV, BLA-CTMX, arising through mutation or gene mobilization. These genes, that is encoding the extended spectrum beta lactamase gene, they are mainly located on conjugative plasmid, that is heavy plasmid, and these conjugative plasmid are basically horizontally transmitted from one bacteria to another species, or animal to human or human to animal. And these genes are also situated on insertion sequences, that is also short mobile genetic segment of gene that is transmitted from one segment to the other segment, and they are also located on integrons, which also mobile genetic element that play important role in the dissemination and spread of these antibiotic genes. And plasmid frequently co-harbor resistance gene, and the plasmid also carry the gene for gene resistance for other antibiotic like aminoglycoside group of antibiotic, fluoroquinones, sulfonamides, that they play important role in developing the multi-drug resistance bacteria, because plasmid is a extra chromosomal genetic material that are very easily transmitted horizontally between one bacteria to another bacteria, and they also carry the resistance gene against other group of antibiotics. So MDR comes on MDR, that is called superbugs, are those bacteria that develop resistance against at least one antibiotic of three or more than three classes of different antibiotics, that is also called superbugs. They have they also possess the high risk. Then what is the characteristic of extended spectrum beta lactamase? These extended spectrum beta lactamase enzymes play important role to develop resistance against penicillin group of antibiotic, fourth, second, and third generation of cephalosporin, and also against the aztreonam. And the extended spectrum beta lactamase activity inhibited by beta lactamase inhibitors such as galvanic acid, salbactam, tazobactam. These are antibiotics that can be inhibited by beta lactamase inhibitor, that they play important role. Then inhibition by the inhibition by the beta-lactamases. Most ESBL classes, that is mainly belong to BLA-TAM, BLA-SHV, BLA-CTMX, are inhibited by galvanic acid, sulbactam, tazobactam, and azobactam. These are the antibiotics that mainly inhibit the activity of beta-lactamases, which are commonly used beta-lactamase inhibitors. These are molecular structure of different beta-lactamase inhibitors like galvanic acid, sulbactam, tazobactam, and azobactam. These are antibiotics that have activity against beta-lactamases. Then how they act? These beta-lactamase inhibitors act as suicidal substrate. The main work of these extended beta-lactase inhibitor that they bind irreversibly to the active serine residue that is present in extended spectrum beta-lactamases and permanently block the catalytic site, thus preventing the enzyme from the hydrolysis of antibiotic. Because the main work of extended spectrum beta-lactamase enzyme is to catalyze hydrolyze the carbon nitrogen bond that is present in the beta-lactam of these antibiotics. They permanently block that catalytic site, thus preventing the enzyme from the hydrolysis of antibiotics. Thus the activity of the antibiotics is maintained and they are able to work and destroying the bacteria. Then what is the clinical application? So beta-lactamase inhibitor used in combination of amoxicillin, clavulanic, piperacillin, tazobactam, and ampicillin sulbactams are effective against the ESBL producer. These antibiotics in combination of these beta-lactamase inhibitors are used against these extended spectrum beta-lactamase producing bacteria. What is limitation? Not all ESBL are equally inhibited, but these inhibitors are not equally important for all extended spectrum beta-lactamases. Then what are different reservoirs that play important role as a reservoir? Then Escherichia coli, most prevalent ESBL host, particularly globally dominant in which carry BLA-CTMX15. That these genes are most prominent across the globe and worldwide, and that play important role for causing the urinary tract infections, bloodstream infections, and zoonotic reservoir in food animals. They are basically responsible. Klebsiella, as we all know that Klebsiella is mainly nosocomial pathogens, that is hospital-acquired pathogens, and they also play important role in dissemination and spread of BLA-SHV, BLA-TAM, and BLA-CTMX gene, and they are mainly responsible for causing the intensive ICU's infection in hospitals, and UTIs mainly responsible for causing the urinary tract infection and ICU's infection in the hospital. Then, as per World Health Organization, a critical priority pathogen, these Escherichia coli, mainly the Escherichia coli and Klebsiella, considered as critical priority pathogens of the family Enterobacteriaceae. Then other enterobacterias, they also act as a reservoir like Proteus mirabilis, Salmonella, Citrobacter, Morganella. They also poses a reservoir and play important role in zoonotic transmission by the contaminated food forming environments. Then Salmonella enterica, particularly important in foodborne outbreak, and these is where producing strain complicate therapy in gastrointestinal and invasive salmonellosis as per et al. 2017. Then some non-fermenters, they act as a secondary host like Pseudomonas aeruginosa. They occasionally produces ESBLs. Carbapenems are more common, but in Pseudomonas aeruginosa, the carbapenemase enzymes are more important as compared to extended spectrum beta-lactamase. And these extended spectrum beta-lactamase carries an increased beta-lactam resistance and complicate the intensive care unit management. Acinetobacter brumeni also have ESBL activity, and they play important role in hospital-acquired infection, especially in critical care and veterinary hospitals. Then zoonotic and environmental reservoir food animal like poultry, cattle, swines. They are frequently isolated from livestock and linked to antibiotic use in agriculture. Companion animals like dog and cats, they also recognized as the carrier of Blachitimiax SHV, representing a household to human transmission because they have close contact with humans, so they play important role. These companion animals, dog and cat, play important role in the transmission of these extended spectrum beta-lactamase gene. In environmental reservoirs like water, soil, rivers, showing persistent and horizontal transmission potential environment, because environment also it as a reservoir through food chains. They enters into the human as well as animals. Then ESBL superbugs, as we discussed that these bacteria like Escherichia coli, Klebsiella pneumoniae, and other enterobacterials, they act as a reservoir for these extended spectrum beta-lactamase genes, and they, as we know, Escherichia coli mainly responsible for causing the urinary tract infections, blood-stain infections, and other zoonotic infections. And as we know, Klebsiella pneumoniae, they are also responsible for causing the ICU's infection and hospital-acquired infections, mainly intensive ICU's infection as well as urinary tract infection are mainly caused by Klebsiella pneumoniae. And other enterobacterial salmonella, these are responsible for causing the food poisoning. So these are reservoirs for these extended spectrum beta-lactamase, and how they are transmitted from human to animal, animal to farm animal, and through farm animals they are responsible for food-borne importance, and through the food chains they are entered into the human. So these bacteria cycle between human, animal, food, and environment. This diagram depicts how they are transmitted from human to animal and animal to human through the food chain. Then, as we all know, nowadays most of the industry, they use these antibiotics as a growth promoter or profile as a prophylaxis used these antibiotics. So these animals act as a food animals that play important. These food animals play important role in transmission of these extended spectrum beta-lactamase genes, because during the slaughtering of animal, milking, or preserving at the time of processing of meat or food obtained from the animal, these become contaminated due to unhygienic condition. These foods get contaminated, and when we eat these foods or vegetable sold in the market, then we get the infected. So people get infected, infection to these antibiotic resistant bacteria. So overuse or use of these antibiotics play important role in the development of antimicrobial resistance, because excess use of antibiotics as a prophylaxis or growth promoter become dangerous and play important role in the development of antimicrobial resistance bacteria. Then why ESBL concern? ESBL is a major extended beta-lactamase nowadays major concern, because they lead to treatment failure. They are also responsible for causing the high mortality. OneHealth is spread because they are transmitted from human to animal and animal to human beings. Healthcare burden, they also have a burden on healthcare. They play important role in the development of multi-drug resistance, because these ESBL genes mostly situated on plasmids, and plasmids are extra chromosomal genetic material. They also carry the gene that resistance to other group of antibiotics. So they play important role in the development of multi-drug resistance bacteria, and these multi-drug resistance bacteria are responsible for causing the treatment failure. And this due to development extended spectrum beta-lactamase resistance, we use the last line of drug, that is the carbapenems. As we know, carbapenem considered as a last resort of drug that is used to treat the infection against the extended spectrum beta-lactamase. So they compel the use of last resort of drug, that is carbapenems, against the extended spectrum beta-lactamase resistance bacteria. So it is a major cause of death or mortality across the world. Then what is the major causes? So major causes are misuse of antibiotics, that is inappropriate use of antibiotic, prescribe incompliance, overuse in animals, overuse in terms of most antibiotic use for growth promotion as well as prophylaxis, and inadequate hygiene in clinic and farm. The inadequate hygiene or sanitation also play important role in the development of antimicrobial resistance, because they are through the food animal, they are transmitted to the human, and zoonotic pathogens are also transmitted from human to animal and animal to human. And environmental spread, from environmental spread occur due to pharmaceutical runoff or wastage expelled from the hospitals that contaminate the environment, and from environment it spread to the from hospital it is spread to the environment, and through environment they comes into animal as well human beings. Like when animal get infection or livestock or pets, they get infection, and due to direct contact with the humans or through the food chain, they enters into the human, and from humans they enters into the community setting, hospitals, and from due to wastes from the hospitals, they contaminate the sewage and water, and through this sewage and water they contaminate the environment like soil and water, and through soil and water our foods in, they finally enters into the animal. In this way they are transmitted from animal to human, and animal to environment, and environment to any animals. Then extended spectrum beta-lactamase resistance, and what is the solution? As we know, antimicrobial resistance is the major cause of death, and a serious concern across the world, and attracted the attention of larger scientific community across the world. So there is need of global public awareness. There should be awareness about the antimicrobial resistance in the peoples living in that particular area, and also improve the hygiene. Hygiene is also one of the most important factor that play important role in controlling the antimicrobial resistance, because due to unhygienic condition or poor sanitation, they are transmitted from animal to human, and human to animal, because most of the bacteria that are present in the animal through the food, or during the time of slaughtering or milking, they contaminate the food product, and when the human get that product, they get contaminated and they get infection. So improvement hygiene is also one of the important steps to controlling the extended spectrum beta-lactamase resistance. Vaccine and alternative, there should be vaccine against this extended spectrum beta-lactamase, and any other alternative should be there. Reduce the antimicrobial use in agriculture. As earlier told that antibiotics mainly used as a growth promoter or prophylaxis, so that is play important role in the development of antimicrobial resistance. So there is reduce the use of antimicrobial antibiotics as a growth promoter or prophylaxis. Global surveillance on MRI. There should be global surveillance. There should be data on antimicrobial resistance. By performing the antimicrobial resistance susceptibility test, we know the which gene is dominant in that particular area. That may be BLASTMX gene, BLASHV gene, or BLATAM gene. Which gene is dominate in that particular area. So global surveillance is a very important database study should be there. development of new drugs. There should be also the techniques to develop new drugs, because when bacteria develop resistance against these antibiotics, so there should be new drugs for treating that particular patient that develop resistance against these beta-lactam antibiotics. Then there should be also the higher number people working in. There should be more facilities given to the workers that working in this area, that is handling the infectious pathogen, provide more they provide more beneficiaries for that particular workers that work in this area. And testing should be rapid. There should be rapid testing facilities. If we have good diagnostic facilities, then we frequently characterize that particular gene, and we make a particular strategy for control of that particular gene. And and global awareness I later on. So these are 10 points that play important role in controlling the antimicrobial resistance. Then what is antibiotic resistance and crisis for global health and animal wealth? These are same points here. Addressing the global health crisis, first step, replacing the old medicine. There, due to continuous use of same medicine over a long period of time, they play important role in developing the resistance against that particular antibiotics. So there should be change in the use of antibiotics by performing the antibiotic susceptibility testing. By performing that test, we are able to identify which antibiotics nowadays, which antibiotics susceptible against that resistance pathogen. And there should be rapid diagnosis is also one of the important steps, because if diagnosis is good, we are able to control the infection. If we diagnose any gene which are responsible for that particular disease, then we make a proper strategy against that particular genes, eliminating the needless drug uses. That means needless, we should never use the excess drug. When there is need of drug, then we use. Over use of drug should be inhibited. Then antimicrobial supply chain must be managed to ensure the safety, security, and control. The supply of chain should be safety, should have safety, security, and also have control. And use of antimicrobials in agriculture and ecosystem must also be used sparingly and with the minimum waste. They should these antibiotics not used as a growth promoter in excess. There should be minimal use in the industry. Immunization and other measures, reducing our reliance to an antibiotic and limiting the emergence and dissemination of drug resistance through infection prevention, control, and surveillance. Though the prevention, control, and surveillance also play important role in tackling the antimicrobial resistance. Then what are different techniques to control and prevent these antimicrobial resistance? So first one, antibiotic stewardship. Antibiotic stewardship refer to set of commitment and activities designed to reduce the adverse effect of antibiotic while antibiotic use while optimizing the treatment of infection. Then there are different points that we have taken under the antibiotic stewardship. That means first, there is enhancing the infection prevention and control. Controlling the source of infection by knowing the source of controlling the source of infection. When we know what is the source of infection, from where it's come, then we are able to make a proper strategy against that particular gene. Prescribing antibiotic when there are truly need. Without need, there is no prescription of antibiotic. There is no use of antibiotic. Prescribing the appropriate antibiotic. And there should be prescription of antibiotics should be appropriate by performing the antibiotic resistance or minimum inhibitory concentration test. We never use the excess of antibiotics that play important role in the development of antimicrobial resistance. Using the shortest duration of antibiotic based on evidences. We use the shortest duration of antibiotic based on evidence. That means by knowing the dominancy of that particular gene in that particular area, we use the strategy against that particular genes, and supporting the surveillance of antimicrobial resistance and hospital acquired infection, monitoring the antibiotic consumption. We know the dose of antibiotics which are used, so we make a specific study on rational use of antibiotics, continuous monitoring of resistant gene against these antibiotics in livestock, and more strict policies are needed on the uses of antibiotics in order to prevent the emergence and dissemination of these resistance strains within environment and community setting, and also educating the staff. The staff should be properly educated. And that means they have knowledge how to diagnose the resistance gene that develop resistance against these particular antibiotics. By knowing by gaining the knowledge, we are able to diagnose and make a appropriate control strategy against that particular gene. Then these same things discuss reduce the prophylactic and growth promoter use of critically important antimicrobial. These cephalosporin, fluoroquinolones, these are not used as a prophylaxis or growth promoter because they play important role in the development of extended spectrum beta-lactamase, and also promote the vaccination, probiotic, prebiotic, and bacteriophage and competitive. That means we promote the use of vaccination, probiotics, prebiotics, and also alternative therapy against these antibiotics like force therapy, herbal use of antibiotic. This would be preferred to reduce the resistance against these extended spectrum beta lactamase antibiotics. Farm hygiene and biosecurity also play important role by improving the sanitation, vaccination, and good animal husbandry play important role reducing the pressure of extended spectrum beta-lactamase gene in that particular area. Pets are also served reservoir. So these are judicious antibiotic use in veterinary clinics and hygiene awareness among owners. So there is hygiene awareness among owner is very, very important because the companion animals are very close contact to human beings, and if they develop resistance, they are ultimately transmitted to the human. That is major obstacle which is faced by clinicians, pharmaceutical company, and policy makers to treat that bacteria. Environmental measures like proper wastewater treatment in farm, aquaculture, and veterinary hospital should be there to reduce the dissemination and emergence of these extended spectrum beta-lactamase genes. Then there are next is surveillance system. As per World Health Organization global MR surveillance system that standardize the collection of ESBL producing antibacteriously, there should be data-based survey globally and primarily human focused, but now extending to these data these WHO primarily focus the data on human beings, but now they're extending to data regarding the animals and environment sector also as per WHO GLASS report 2021 and OIE World Office of International Epizootics, World Organization for Animal Health, maintaining the global database on antimicrobial use in animal. More than 150 countries reporting these antimicrobial resistance gene and encourage the country to restrict critically important antimicrobials. So more encourage the country, it also encourage the countries to restrict the use of these critically important antimicrobials for animal as per OI 2019. Food and Agriculture Organization also play important role in controlling the antimicrobial resistance in foods, feed, and farms. Track the ESBL gene, ESBL producing E. coli in poultry, cattle, educate. These are as a sentinel indicators. tripartite collaboration of Food Agriculture Organization OIE and WH play important role because they work on One Health antimicrobial resistance surveillance. So zoonotic bacteria, ESBL, Salmonella, they are spread because they are zoonotic in nature. So they are spread from animal to human or human to animal through food and contaminated waters. So next plan is global action plan. The global action plan that governs across the world, they have main 5 strategic objectives. First, improve the awareness and understanding of antimicrobial resistance. There should be everyone have awareness and understanding regarding the antimicrobial resistance, and also strengthen the knowledge through surveillance and research. And if they have knowledge, they strengthen their knowledge through the surveillance and research through they spread their knowledge and reduce the incidence of infection. And also this global action plan play important role in reducing the incidence of infection, and also optimize the use of antimicrobial agents by performing the antibiotic susceptibility test, which antibiotic is susceptible they use, they prescribe, they instruct the use of that particular antibiotics, and develop the economic case for sustainable investment that take account for needs of all countries and increase the investment in new medicine, diagnostic tool, vaccine, and others. They prefer the use of new antibiotics against these extended spectrum beta-lactamase resistance bacteria. So the global action plan play important role to combat the antimicrobial resistance. If no action today, no cure tomorrow. Then come on next study, there is National Action Plan on Antimicrobial Resistance. After the Global Action Plan, we developed the National Action Plan on Antimicrobial Resistance. It has also 6 strategic priorities, because National Action Plan on Antimicrobial Resistance developed after the Global Action Plan, because there are some local problem at national level or state level. So to sort out that problem, develop the National Action Plan and antimicrobial resistance, and these include 6 points. The first is awareness and understanding. There should be awareness and understanding about the antimicrobial resistance through communication, information, education, and communication, through the information, education, and communication that play important role in developing the awareness against this antimicrobial resistance. And these awareness should be done through the education and by organizing the various trainings and through education. Next point is knowledge and evidences. There should be surveillance of antimicrobial resistance in different components, like in what is the resistance pattern in human, animal, and environment. There should be data. Data should be there by using the surveillance system, and development of different laboratories where the gene against these extended beta-lactamase were characterized. This is the good laboratories developed that characterize these genes at the molecular level. So they play important role in development of vaccine to controlling these antibiotic resistance gene. Next, infection prevention and control. There is infection prevention and control that should be at the healthcare committee, and also unit healthcare committee and hospital acquired infections. So there should be a proper prevention and control against the hospital acquired infection, and animal, regarding the animal health. So they play important role, important studies, develop important studies to control the to prevent infection and control. Optimize the use of antibiotics. So regulation assess the antimicrobial resistance pattern and antimicrobial stewardship in human, as well antimicrobial stewardship in animals. So different methods, different point, by using the different points related to antimicrobial stewardship play important role in to optimize the use of this antimicrobial resistance. Innovation Innovation, there should be new area of medicine development of new drugs for treating these antibiotic resistance bacteria. There should be innovative techniques. There should be new innovations, and for developing the new technique and new, there should be financing. If there is good financing support, financial support, then there will be good research and development of good medicine have been occurred. Leadership is a combination of different politicians together, and it is a collaborative approach. That collaboration should be done at international level, national level, and state level, because at international collaboration, how the India's play important role in controlling these antimicrobial resistance across the globe. At national collaboration, there should be some problem that is happen at national level, so there should be national collaborative there should be collaborative approach at national level and state level. There are some problem relating to state level, like disease diagnostic techniques and other things. So there are some problem that is facing on state levels. So there should be collaborative approach across the international level, national level, and state level. Then comes on OneHealth. OneHealth is a collaborative efforts of multiple disciplines working locally, nationally, and globally to attain the optimal health for people, animal, and our environment. Because it is the collaborative approach that think about the healthy environment, healthy human, and healthy animals. It also play pivotal role in addressing antimicrobial resistance, as it is recognized the intricate connection between the human, animal, and environment, and also to balance and optimize the health of all living things in the ecosystem, because these three are interconnected. So if there is any disturbance in the environment, may also affect the human, and if there is any disturbance in human, they also affect the animals. So they are intensely related to each other. If there is more use of antibiotics in humans, so they develop resistance, and these resistant genes comes into the environment. When the environment get contaminated, then they enters into animal through food chain, what contaminated food and water, contaminated utensil, milk, and if animal become develop these resistant genes, they comes into the human through the food producing animal. Likewise, if there is any disturbance in the ecosystem, they lead to disturb the health of animals. So OneHealth is a very important play important role in controlling the antimicrobial resistance, because it has important role in addressing the antimicrobial resistance and make a smooth connection between the human, animal, and environment. Thank you. Thank you. Hello. Hello. Hello.
Hello.
Yes, ma'am. Now the lecture finished.
Madam. You can now finish.
I would be happy to take any questions now. Please feel free to do it.